Hi, I'm Carrie Hyde, and I'm the host of the Spawdcast, and I am your pet's life coach. Today we're going to be talking about feline kidney disease. So if you have a cat, I highly recommend you listen to this topic because the number one reason that cats go to veterinarians these days is for kidney failure. So I'm very excited to introduce to you a couple of people, but first I'm going to introduce our guest co-host, Jamie Clifton. How are you?
I'm well, how are you?
I'm doing well, thanks. I think I just pronounced your last name wrong.
It's all good.
We talked about her dad's name is Clifford, her last name is Clifton, and Clifford gets in my mind because of dogs. But anyway, so Jamie is a cat behaviorist, which is why she's here today. So Jamie, tell us a little bit about what a cat behaviorist does.
Well, what I do is I help people to communicate with their cats and vice versa. So I do that through clicker training, which is positive reinforcement-based training. And I also help people to resolve a whole spectrum of issues that go on with cats. So whether that's not using the litter box or cat-on-cat aggression, just all of those come down to not understanding the basic needs of the cat. So that's what I help do.
That's awesome. That's awesome. Yeah. Well, I brought Jamie on because I know she sees a lot of cats. And so we're really trying to get the message out so we can help our cats live happier, healthier lives. So together, Jamie and I are going to be interviewing our next guest, which I am always so excited to introduce to you because she's an amazing, amazing veterinarian, Dr. Jean Dodds. Thank you for being here today.
You're welcome. My pleasure.
So Dr. Dodds, if you don't know, is world-renowned. She's fabulous, but her practice is in Garden Grove, so she's very close to me and the spa, which is great for me because I can refer my clients to her, and back and forth we can kind of work together that way. So I'm just so excited, Dr. Dodds, that you're here. So we want our cats to have an acidic urine, right?
Acidic urine, lots of liquids, and the foods that are promote well-being and not the glutens and the grains and all the other things we have in commercial pet foods that often have too much carbohydrate and sugar in them because they're more palatable that way. And the cat, unlike the dog, is an obligate carnivore. They must have meat in their diet. The dog can have both meat and carbohydrates and grains and cereals because they've adapted to that from the original wolf. The cat has not. So even though people think that the cat can eat lots of grains and carbohydrates and they're tastier and yummier, just like us, they get fat and they get lazy and they can have many diseases, especially diabetes and kidney disease.
Do you think that spaying and neutering has an effect on kidney disease at all? Like too early or too late? Is there a better time to spay or neuter, or is there a link to that at all?
Well, you know, you're asking me all kinds of very important, complicated questions, and the answer is convoluted. Because yes, there definitely is a trend to want to spay and neuter dogs and cats later than we used to. And in pounds and shelters where they've got a problem with euthanasia, if these animals are not adopted, they have to neuter and spay kittens and puppies much earlier than they would ideally, because otherwise they're going to go out and reproduce. So we've got this societal dilemma. What's best for the cat and the dog, and what's best for us in society? Oh, yeah. And they don't mesh. So for example, we like to neuter cats and dogs when they're at puberty, okay? The problem with the female cat, however, even though we want to spay a female dog later, like after 2 heat cycles, can't do that in the cat because they keep cycling. So everybody tries to keep the cat from cycling, you know, with using a Q-tip and trying to fool the cat into thinking they're being serviced, so to speak, but it doesn't always work.
Wait,
and then we have the problem with the feral and male cats running around.
Did you say something about a Q-tip?